Janitor who speaks 5 languages saves life of patient doctors couldn't help. The hallway on the 4th floor was always the quietest, but also the most arrogant. It was the wing reserved for international patients, where bilingual signs gleamed on white walls and silence was broken only by the discreet clicks of expensive shoes and the contained voices of doctors struggling to sound confident in foreign languages. There, every gesture seemed rehearsed, every glance calculated, except Ivana's. Pushing her old cleaning cart, she moved like someone who had already learned to disappear. She wore a patterned scarf tied at the back of her head with a discreet knot, and her eyes, her eyes. They carried something few noticed, a kind of deep attention, like someone who hears everything, even when no one speaks to her. The little wheels creaked a bit, especially when crossing the worn floor near room 408. She knew this, always adjusting her pace to avoid disturbing the patients. Doctors' headphones, tablet taps, the clinking of trays all formed the soundtrack of the morning shift. But Ivana had her own symphony. Bucket, mop, soap, silence. That morning, she stopped in front of the bulletin board. A new poster, printed on glossy paper, caught her attention with letters in French. She stepped closer, tilting her head. The tone was formal, but something bothered her. The central sentence read, "Les visites sont interdites en cas de grossesse." Visits are prohibited in case of pregnancy. Ivana frowned. It was a subtle but serious mistake. In French, interdites meant forbidden, something rigid, almost offensive when addressing patients. The correct word should have been restraintes, restricted. She looked around. No one was paying attention to her. As usual, from her uniform pocket, she pulled out a blue pen. With a light gesture, she carefully crossed out the wrong word and rewrote the correct one, with clear handwriting and the proper accent. Then she stepped back to observe. Now it made sense. Next to the poster, a group of doctors discussed the exam schedule. They were so absorbed in their own importance that they didn't even notice the thin woman correcting something in plain sight. But not everyone let it slide. "Hey, is the janitor a French teacher now?" One of them commented quietly, with a sly smile. Another followed the tone. "Careful, soon she'll be prescribing antibiotics." Muffled laughter. Ivana didn't react immediately, but her eyes, once lowered, lifted. They met the first doctor's gaze, direct and unwavering. She approached lightly, as if to clean the floor beneath their feet. Then, with the rag still in hand, she spoke calmly. "L'ignorance crie. La connaissance chuchote." Ignorance shouts. Knowledge whispers. Silence. The group exchanged glances. One of the residents, trying to hide his surprise, attempted to repeat the phrase, but mixed up the words. He said something meaningless. Ivana smiled gently, and finished, still in French, with a touch of polite irony. "Cinq langues, docteur. Mais la patience est toujours la plus difficile à apprendre." 5 languages, doctor. But patience is always the hardest to learn. She turned and resumed her routine as if nothing had happened. The rag dipped back into the bucket. The wheels creaked softly once again. But now there was something in the air, as if the dust of arrogance had begun to settle. The youngest doctor in the group watched Ivana walk away, her forehead slightly furrowed. It wasn't exactly surprise, it was curiosity. 5 languages, she thought. But she said nothing. And in a way, it was the most respectful silence Ivana had received in that place in years. The clock struck 11:10 as the confident footsteps of Dr. Leandro Barbosa echoed through the polished corridor of the international wing. He was the new head of the clinic, 38 years old, impeccably dressed in a blazer, with a gaze that weighed resumes in seconds. Around him orbited 3 residents, Lara, Eduardo, and Bruno, each carrying clipboards, tablets, and anxiety disguised as professional diligence. They followed him like luminous satellites, eager for the approval of the sun they deemed indisputable. Leandro stopped in front of room 413, where, according to the schedule, they were to evaluate a Canadian executive in post-operative care. Before entering, he noticed the poster retouched by Ivana on the bulletin board. The blue ink jumped out against the glossy paper, betraying an unofficial hand. He raised an eyebrow, adjusted his thin glasses, and summoned the team with a discreet click of his tongue. "Did anyone here authorize a change to institutional material?" he asked quietly, almost through clenched teeth. The residents shook their heads. Bruno ventured. "I think it was the janitor, doctor. She crossed that out earlier." Leandro frowned, approached the poster as if examining a rare bacteria. He read the text, identified the replaced word, "Anterdes" for restraintes. It took 2 seconds to silently admit that the new term was more appropriate. But aloud, something else came out. Unthinkable audacity. "Imagine if every employee decided to edit our protocol, Laura." He addressed the resident, but loud enough to echo down the corridor. Next stop, janitor reciting antibiotic dosages. Eduardo, always ready to laugh at the boss's jokes, let out a quick laugh, sharp as metal. Laura hesitated but went along. Bruno tried to remain neutral. He still remembered Ivana's elegant phrase from earlier. The group entered 413. Door closed, patients, exams, prescriptions. Outside, Ivana returned to the bucket and mop, pretending not to have heard. Still, the words "unthinkable audacity" tinkled in her head like cracked glass, vibrating with every step. She took a deep breath, adjusted her scarf, and resumed work. But the corridor seemed narrower, the cold lights harsher, the disinfectant smell more acidic. 2 hours later, the lunch shift brought a different rhythm to the hospital. Doctors retreated to the private cafeteria, discussing mortality indicators and the questionable taste of the low-fat stroganoff. Ivana glided through the lobby with detergent sachets, going back and forth between empty tables. She overheard snippets of conversation. And she even dared to correct in French, Eduardo said theatrically. 5 languages, she says, Laura added. Must be counting Spanish and porthole and goodwill. Muffled laughter, cutlery clinking. Ivana pretended not to notice. But each sentence stuck like damp dust in the corner of her bucket. Not even the strong coffee smell could mask the irony. On her way out, she crossed paths with Bruno in the service corridor. The resident carried a plastic cup, seeming more thoughtful than arrogant. "Mrs. Ivana," he called softly. "Sorry about what happened earlier. It was rude." The correction was actually right. She raised her eyes, surprised by the apology. She smiled faintly. "Merci, jeune docteur. Life is too short to keep offense in a closed jar." Bruno blushed, speechless. He wanted to ask how she had learned such clear French, but the beep in his pocket sounded urgently. He said, "Excuse me," and left, leaving Ivana with a mix of relief and anguish. Someone at least had noticed the wound. The meeting of the 3. At 3 o'clock, the clinic and research team gathered in Conference Room B. Topic: Cooperation Protocol with a Japanese university sending fellows to the hospital. The Director of International Relations, Dr. Fukuda, had traveled from Tokyo to finalize details. However, the contracted interpreter had been stuck in another city due to a flight cancellation. The hospital was relying on simultaneous translation software via tablet. Ivana, finishing polishing the floor in the corridor just outside, heard the preparations. Cables, microphones, the typical plug-and-pray technology hustle. Without human intervention, the digital magic would translate everything. Leandro appeared, exuding authority. He called an IT technician. "Make sure this software works. We can't embarrass ourselves in front of Dr. Fukuda." The technician nodded, sweating. Laura nervously reviewed slides full of English and Japanese terms. Eduardo played with the laser pointer, mimicking invisible shurikens. Bruno read notes, still absorbed. Ivana gathered the bucket. For a moment, she imagined herself entering through the glass door to offer help. But she remembered the laughter in the cafeteria and swallowed the idea. She resumed pushing the cart. However, one wheel caught on a tiny crack in the floor, the same one near 408 that squeaked. The bucket shook, spilling drops. Before they could fall, she bent quickly, catching them with the rag. When she looked up, she noticed Leandro inside the room staring at her with pure disdain. He raised a finger, like a conductor directing a silent boo, and partially closed the frosted glass blind, blocking her view. It was a small gesture, but cutting. A dividing line between them and her. The system's eclipse. 10 minutes later, a sharp static noise pierced the conference room door. A murmur followed, raised voices, microphone banging. The translation system choked on corrupted characters, spitting out nonsense phrases. Summoning error 504. Blinked on the tablet screen. Bruno rushed out, asking IT for help. Herald of anxiety, his voice carried the panic of someone watching their reputation melt away. Ivana, farther down the hall, lined up rooms in the storage room. She heard the commotion, the calls for Wi-Fi signal, the laments in broken English. Her heart raced, not with joy, but with a strange compassion mixed with memories of times when translation was a mission, not streaming. The ultimate humiliation. Red-faced, Leandro decided to continue without the system, relying on his own English. Barely had he begun when Fukuda asked a long question in Japanese about clinical trial methodologies. The chief stammered, threw glances at the residents. Eduardo tried to help with an out-of-context yes, of course. Lara, desperate, opened the next slide, where the word placebo was misspelled palcebo. The foreign director frowned, polite but confused. Outside, staff and nurses began noticing the tension through the slightly open door. Ivana, standing with a damp rag in her hands, watched silently, as if observing children about to break the house's most expensive vase. Then Eduardo, in a final attempt to save face, said something aloud in Portuguese, sure Fukuda wouldn't understand. We should call the polyglot janitor. They say she solves everything. Nervous laughter spread through the room. The sound escaped into the corridor, gaining an echo of mockery. Ivana felt her blood boil, but not from pride. She remembered the years she had been an interpreter at medical conferences on rare diseases, the nights spent studying glossaries, the moment she lost her husband and livelihood, yet she would never commit such a rude act against another human being. It was then that Lara, under pressure, ran out of the room, saw Ivana so close, and in a half-desperate, half-hopeful impulse, said in a trembling voice, "Mrs. Ivana, do you happen to speak Japanese?" The question hung, vibrant, between buckets and half-closed blinds. No one laughed anymore. The heavy air in the corridor seemed to wait for the answer, like a witness to a silent duel. Ivana placed the rag on the cart, straightened her back. Her brown eyes, once gentle, now held a firm flame. I do, and if necessary, Russian, German, French, and English. But if I go in there, it's not to be a miracle worker for broken software. It's to translate with respect for the patient, for Dr. Fukuda, and for anyone who thinks rank and character are the same thing. Still need help. Lara swallowed hard, nodded almost like an apology. The glass door of room B slid open with a dry click. All eyes turned, some in relief, others in pure astonishment, toward the figure who entered, still pushing the cleaning cart. Ivana had not asked for time to change out of her uniform. She wore the gray apron speckled with disinfectant splashes, surgical gloves hanging from her pocket, and the floral scarf that now seemed like a silent banner of resistance. Dr. Fukuda stood up, slightly bowed as a sign of courtesy. He did not understand what was happening but sensed the tension in the air. Ivana bowed in a restrained greeting and formally introduced herself in Japanese. Dr. Fukuda, pleased to meet you. My name is Ivana. Today I will be your interpreter. Her clear pronunciation shattered the air like crystal. Fukuda smiled, surprised. Leandro, stunned, took a long moment before closing his mouth. Lara almost dropped her folder. Ivana turned to the team and, in accent-free English, translated. Dr. Fukuda thanks you for the opportunity and is ready for the presentation. Chairs creaked. People sat down again, nervously rearranging papers. The technician restarted the projector, but it seemed as if the entire screen had become unnecessary in the presence of this new force. The meeting resumed its flow, now led by Ivana. She switched seamlessly between Japanese, English, and Portuguese as if changing instruments in the same orchestra. Fukuda asked a long question about clinical trial protocols. Ivana translated into Portuguese for Leandro. He wants to know if we will follow the analytical approach, intention to treat, or per protocol in the reports. Leandro, his vanity still struggling to recover, choked on a, of course, intention to treat, naturally, trying to appear comfortable. Ivana converted the answer, carefully adjusting technical terms. We plan to proceed with ITT analysis. We will also present the exclusion criteria for subjects. Fukuda nodded approvingly and jotted something down. At the corners of the room, the residents exchanged sideways glances, half gratitude, half shame. The session was sliding along smoothly when a sharp beep cut through the room. Bruno answered his pager, went pale, and whispered something to Lara. She stood and approached Ivana, murmuring, "It's the patient in the international ICU, the Canadian who had bypass surgery yesterday. His family just arrived, they only speak French, and are in a panic. We have no translator available." Leandro cleared his throat, already resigned. "Ivana, could you?" She nodded, excusing herself to Dr. Fukuda in Japanese. Explaining the urgency, she assured him she would return as soon as possible. The director smiled, saying he fully understood the clinical priority. After all, saving lives was the most universal language. On the way, Lara guided Ivana through elevators and sterile corridors while rattling off clinical data. Ivana absorbed it all, remembering even during the rush to keep her tone gentle so the young resident wouldn't sink into guilt. They arrived at the intensive waiting room. 2 gray-haired men and a red-haired teenager cried behind foggy glasses. Seeing Ivana in her cleaning uniform, they frowned, but Lara quickly introduced her. Ivana knelt before them at eye level and spoke in French, so soft it felt like a pillow. "Je sais que vous êtes inquiets. Permettez-moi de vous expliquer l'état de Monsieur Hébert etc. que l'équipe médicale fait pour lui." "I know you're worried. Allow me to explain Mr. Hébert's condition and what the medical team is doing for him." Their tense faces relaxed like loose strings. The patient's father held her hands, thanking her between sobs. "Merci, madame. Vous êtes notre ange aujourd'hui." "Thank you, ma'am. You are our angel today." Ivana translated simultaneously for Lara, who clarified postoperative details. When the teenager asked if she could see her brother, Ivana added, "We can arrange a brief visit with sterile gowns, but you must stay calm, so as not to affect his blood pressure." Calm returned in minutes, a miracle crafted from empathy and vocabulary. As soon as she finished, the internal radio buzzed again. Bruno, on the other end, reported a Russian-Japanese patient in room 327 with a high fever and complaints no one could understand. Lara looked at Ivana. The janitor interpreter just smiled, as if the next piece of the puzzle was already in her mind. Corridor, stairs, metal door. There they found the man in his 30s, sweaty skin, weak voice firing off rushed Russian. The nurse tried using a phone app, but produced only grotesque phrases. Ivana approached. "What do you feel? Where does it hurt? I am here to help." He spoke of stabbing abdominal pain, wild mushrooms eaten on a hike 2 nights before. Ivana translated at lightning speed, adding a hypothesis of ibotenic toxin poisoning, a memory from mycology conferences she had attended in Prague. Lara's eyes widened. "You know that from memory? When you love words, you end up loving what they carry. Science, entheogens, stories." Bruno ran to request the appropriate antidote. The protocol was activated in record time. Back in room B, 40 minutes later, Ivana apologized for the delay. Fukuda stood again, but this time it was not just courtesy, it was clear respect. He told the group, while Ivana solved crises, that not even many professional interpreters master clinical terminology with such fluency. The meeting ended without incident. After the last slide, Leandro took a deep breath, approached Ivana, and in a tone mixing defeat and admiration, said slowly, "Miss Ivana, I have no words in any language to thank you enough." She tilted her head. "Doctor, Words are never lacking. Sometimes, it's just ears willing to listen that are missing. In the corridor, while gathering the cart, she heard quick footsteps. It was Bruno, holding an envelope. He handed it to her, blushing. It's a formal invitation to join our language support department. With senior interpreter salary. It was Fukuda-san and the council's idea. Ivana ran her fingers over the seal, without opening it. She breathed the chlorine-scented air, feeling the light weight of the paper, so light compared to the empty bucket. "Thank you," she murmured. "But today I still have floors to keep safe. Tomorrow we talk in which language do you prefer?" Bruno smiled, relieved, understanding that here, the one who chose the language and the pace was her. And for the rest of the shift, the cartwheels no longer creaked. They glided, as if the hospital itself, finally bilingual in humility and gratitude, had lubricated every gear so that the voice that saves, translates, and honors could continue its course. Clear, gentle, indispensable. The digital clock on the wall blinked 4:37 p.m. as Ivana stepped through the door of room 327, carrying on her chest the residue of the afternoon's linguistic marathon. The Russian-Japanese patient, Mr. Sato Leonidovich, 33 years old, a field biologist, was sweating in waves, his hands clenched over his abdomen, his breathing short and fluttering like a frightened bird. The monitors beeped intermittently, each tone like a hammer strike on thin steel. Laura adjusted the four-line. Bruno fiddled with the infrared thermometer, which stubbornly read 103.6 degrees Fahrenheit, 39.8 degrees Celsius. Nurse Claudia was preparing an antipyretic injection, but doubt hovered in the air. Was it safe without knowing the exact toxin? Leandro, summoned in a rush, flipped through a clinical mycology compendium like someone searching for a needle in fog. Ivana approached the stretcher without hesitation. She removed her vinyl gloves, replaced them with a fresh pair, and cracked her knuckles, a reflexive gesture, like a maestro lifting their baton before a symphony. "Where exactly does it hurt? Cramping or burning?" Leonidovich moaned, gasped out a few rushed syllables. Ivana simultaneously translated for Lara. Diffuse burning pain radiating to the back. Severe nausea, since midday. He confirms ingestion of Amanita muscaria, but the sample was sun-dried, potentially more concentrated. Leandro looked up. Muscimol and ibotenic acid. Risk of seizure and liver failure. Bruno, standard antidote won't do. We'll need a benzodiazepine to prevent convulsions. Ivana turned to the patient, switching to Japanese, the language he clearly associated with childhood comfort. "Stay calm. We'll begin treatment now. Breathe steadily. Count slowly." Meanwhile, Claudia called out the vitals. Oxygen at 91%. Blood pressure 90/50. Irregular pulse. Leandro prepared injectable diazepam but hesitated. Without blood confirmation, the dose might depress his respiratory center too much. Ivana closed her eyes briefly, reaching into her mental archives. Remote conferences, mushroom intoxication cases in Yakutsk, 2012. Professor Mikhailov had mentioned that ibotenic acid partially converts to muscimol under heat. Pharmacokinetic math pulsed through her thoughts. She opened her eyes, locked onto Leandro. A minimum dose of 0.05 milligrams per kilogram stabilizes without suppressing respiration. He weighs 72 kilograms, 3.6 milligrams for. Then, activated charcoal through nasogastric tube to absorb the residue. Leandro, humbled yet enlightened, nodded. Bruno, prep 4 milligrams diazepam, 0.4% solution. Claudia, 16 FR tube, get the charcoal. The room became a frenzied choreography. Clinking metal, fluid bags swapped, oxygen masks adjusted. Ivana kept her hand on Leonidovich's shoulder, translating every instruction, every movement, as if weaving an invisible net between two worlds, the language of science and the language of human fear. The rhythm of the seconds. Minute 1. Medication administered. Pulse still irregular. Minute 2. Charcoal slides down the tube, absorbing poison. Minute 3. Monitor curves ease. Oxygen rises to 93%. Minute 5. Fever drops to 102 degrees Fahrenheit 38.9 degrees Celsius. Blood pressure improves to 100/60. Laura wiped her forehead, disbelief on her face. Leandro exhaled a long breath, half relief, half surrender of pride. He looked at Ivana as someone who, at last, truly saw. "You saved this man," he admitted, barely audible. "Without you, we might have missed the therapeutic window." Ivana didn't answer right away. She watched the patient fall asleep, muscles finally relaxed, and only when the monitor steadied at 84 BPM did she gently lift her hand from his shoulder. "I only translated what he couldn't say," she whispered. "And what you all knew but couldn't access." Before they could taste victory, a medical intern burst through the door, pale-faced. "Doctors. Hypertensive crisis in ICU 2. The Canadian patient." Lara's eyes widened. "The bypass executive." Leandro pinched his temples. "Our team's down. Ivana, can you stay with Sato?" Ivana nodded, but upon seeing the panic on the intern's face, she felt the pull again. "He's sedated and monitored. I'll stay for 2 minutes to confirm he's stable, then I'll help." "You'll need French with the family, right?" Leandro just nodded, already running. Bruno stayed to monitor Sato, visibly confident in his unlikely colleague. Exactly 120 seconds later, Ivana handed the clipboard to Bruno and ran to the Canadian's bedside. She found Eduardo trying to explain, in broken English, that they needed to adjust a vasodilator. The patient's father wept. The mother recited Hail Marys in rapid Quebecois. The teenage girl hyperventilated, on the verge of collapse. Ivana entered like a steady breeze. "Monsieur et Madame Hébert, votre fils a une tension élevée mais nous avons le médicament exact. Respirez avec moi. 1, 2, 3. Mr. and Mrs. Hébert, your son's blood pressure is high, but we have the exact medication. Breathe with me. 1, 2, 3. The parents matched her rhythm. So did the girl. Eduardo, relieved, could now focus on the nitroprusside dose. From 200/120, the pressure dropped to 170/100 within 10 minutes. The collective heart returned to the chest. When the crisis ended, Eduardo, still sweating, leaned against the wall. "Ivana, I have no idea how to thank you. If it weren't for you, we might have been calling a funeral home or a lawyer." She just placed a hand on his shoulder. "Gratitude is shown by continuing to do the right work, doctor." Eduardo swallowed the lesson. He looked down at his own hands, capable but unsure, and felt the weight of every chuckle he had shared that morning. On her way back to the station, Ivana walked slowly. Her body was exhausted, but her step felt light. The cleaning cart waited in the corner, like an old friend who knew all her secrets. Her phone buzzed in her pocket, a basic model, cracked screen. Message from an unknown number. "Professor Arseniev, Moscow. Remember me? Heard you're in Brazil. We need a senior interpreter for a neurology congress. We'll cover travel and lodging." She smiled. The world was finally remembering her, but she wasn't sure she wanted to return to that stage-lit world. She looked at her bleach-stained scarf, the cart wheels now gleaming after so many eyes had once refused to see them. Maybe she belonged in more than one place. Maybe the language of humility needed fluent speakers when all else failed. Leandro appeared at the far end of the hallway, holding a new white coat. He approached, offering it, his face tinged with overdue emotion. "It's your size. For when you're ready for the role you deserve." Ivana ran her fingers along the starched fabric, inhaled the scent of virgin cotton. Then she sighed and gently handed it back. "A white coat is a beautiful symbol, doctor. But today, I'll finish my round in this apron. The floors still need me. Tomorrow, we'll see what I wear." Life speaks many languages, each in its own time. Leandro wanted to insist, but held back. He gave a small nod, not of authority, but of genuine respect, and walked away. When his silhouette vanished, Ivana leaned against the cart for a moment, closed her eyes, and let the silence wash over her. Footsteps still echoed down the halls, but now they carried less disdain and more reverence. The hospital breathed a new kind of air, oxygenated by a lesson that wouldn't fit in any medical record. Knowledge wears no badge or uniform. And while arrogance makes noise, competence always arrives at just the right time, speaking the language that saves. She pushed the cart. Its wheels, now lubricated by newfound respect, glided without a sound, as Ivana, the polyglot janitor, continued translating not just words, but the very essence of what keeps life pulsing: listening, courage, and humanity.